Your safety equipment is your lifeline in a chlorine emergency. It can help prevent chlorine inhalation and burns to your eyes and skin. Always make sure you have the correct safety equipment. It should be stored in a clean locker, protected from chemicals or dust. Always inspect your PPE before each use. Common items include a full face shield, goggles, rubber gloves, a hard hat, and corrosion-resistant coveralls. The most important safety gear for working with chlorine is respiratory protection equipment. Two types of respiratory protection are typically used: full-face air-purifying respirators and self-contained breathing apparatus, or SCBA. Air-purifying respirators are generally worn during routine maintenance, in an atmosphere with normal oxygen levels, and when minimal chlorine exposure is expected. Always check the maximum approved chlorine concentration for the cartridges you're using. For emergency response or maintenance activities with unknown or high chlorine exposure, an SCBA is required. SCBAs should have at least a 30-minute supply of Class D breathing air. Some utilities also use escape respirators or rescue breathers, smaller air-purifying cartridges or supplied air units designed to provide enough breathable air to enable evacuation. Check with your local regulations to see if these units are appropriate for your plant. Your utility should have a written respiratory program which addresses the PPE required for varying tasks and exposure levels. This program should be used to train all employees who work with chlorine. Regular fit tests are required for all employees. Beards and even mustaches can interfere with a good seal, so if you work with chlorine, break out the razors. It could mean the difference between life and death. OSHA, as well as many states, require testing of respirators every 3 years. Inspect all SCBAs monthly and document the inspection. Whenever working with chlorine, don't take chances. Always wear protective clothing and know how to use your safety equipment.